My dear students, today I will be taking up a very important topic, and the topic would be spinal cord. We will be going about the surgical anatomy of spinal cord and whatsoever needed, the surgical correlations and the important points which are frequently asked by your examiners in the examinations. Now, spinal cord, we would be dealing in various aspects, the extent of the spinal cord, the various new terminologies associated with the spinal cord, and there's a lot of confusion among the students regarding these terms in the spinal cord. I will be clarifying these doubts. Now, having a look at the board, again the topic of the day, as I mentioned, is the spinal cord and the surgical anatomy of the spinal cord. Now, first of all, going to the parameters which are frequently asked about the spinal cord. As you are well aware, the spinal cord is a cylindrical column almost 45 centimeters in length, and it is a non-uniform cylindrical structure. The diameter of the spinal cord is not the same everywhere. Number one. Number second point is that above it is continuous with the medulla oblongata, and below it tapers. Below it becomes conical, and the name given to the terminal part of the spinal cord, as you can see in the board, is conus medullaris. So conus medullaris is nothing, it is the conical termination of the spinal cord. Now, first of all, we have to remember that from the spinal cord, from the terminal end of the spinal cord, there is a fold of pia mater, which also takes its origin from the conus medullaris, and that is given the name as phylum terminale. There are three important terms which are associated with spinal cord: conus medullaris, phylum terminale, and cauda equina. Now, what are these three terms? As mentioned about the two terms, conus medullaris is nothing but the terminal part of the spinal cord. And from the spinal cord, from the conus medullaris, exits a fold of pia mater, and that is given the name as phylum terminale. Now, what is cauda equina? In the lower part of the spinal cord, the spinal nerves are congested because there is a relative discrepancy between the growth of the vertebral column and the spinal cord. And in the lower part of the spinal cord, the spinal nerves get aggregated together to give the resemblance to the tail of a horse. Cauda means tail, equinus refers to horse. So cauda equina is nothing but an aggregation of nerve rootlets from the terminal part of the spinal cord which resemble the tail of the horse. So this is about the three terms which one has to be very specific about. In addition, you have to remember that the spinal cord is shorter than the vertebral column. The vertebral column continues to grow, and the spinal cord just does not grow in coordination with the vertebral column. Now, another important thing is that the spinal cord is not uniform. As earlier mentioned, there are two enlargements. One is the cervical enlargement and another is the lumbar enlargement, which I will be showing in the figure subsequently. So, what holds the spinal cord in the vertebral canal? The two structures. Number one, the phylum terminale, as I just mentioned. Then there is the dentaculate ligaments. The dentaculate ligaments are again folds of pia mater which bind the spinal cord laterally to the vertebral canal inside. And then there is the dura mater, which is attached above to the margins of the foramen magnum, and on either side it is attached to the intervertebral foramina. So these three important structures, the phylum terminale, the dentoculatum ligamentum dentoculatum, or the dentoculate ligaments, and the dura mater, attach the spinal cord to the inside of the vertebral canal. Now, what are some of the important facts which are asked about the spinal cord? You have to remember that there's a relative disproportionate between the termination of the spinal cord in infants and the adults. In the adults, the spinal cord ends at L1, L2 level, and in infants it ends at L3 level. Now, important, the spinal cord is a part of the nervous system, and you have got the meninges associated with the spinal cord as well as the brain. So the spinal meninges are also attached with the cord, and the termination of the spinal meninges is different from where the cord terminates. In adults, as I mentioned, the cord terminates at the level of L1, but you can see at the board that the dural sheath and the subarachnoid space or the subdural space both end at S2. They do not end at L1. So they continue below the spinal cord. And you have to remember that there are 31 pairs of spinal nerves in the spinal cord. This is roughly some of the important numerical things associated with the spinal cord: the number of spinal nerves, the number of denticulated ligaments, which vary from 21 to 25, and the termination of the spinal cord, which is different in infants and which is different in adults. Now, having a look at the board, you can see that, as I mentioned earlier, that this is the spinal cord, and you can see over here, this is the cervical enlargement and this is the lumbar enlargement, and you can see the terminal part of the spinal cord is conical, conus medullaris, and from the conus medullaris just is a projection downwards, pilum terminale, already explained. Now, the cervical roots, the thoracic roots, the lumbar roots, and the sacral and the coccygeal roots are also shown in the figure. What is asked about spinal cord is the blood supply of the spinal cord, and blood supply of the spinal cord has got its own clinical implications. Basically, the spinal cord is supplied by, over here you can see in the board, one anterior spinal artery and a posterior spinal artery. Over here it is shown there is one anterior spinal artery and two posterior spinal arteries, and they are branches from the vertebral artery. Very, very important. So what is the functional significance of the blood supply of the spinal cord? Basically, the spinal cord does not receive its blood supply only from the anterior and the posterior spinal arteries, but it is also augmented by branches from the ascending cervical and the intercostal arteries, especially the posterior intercostal arteries, and from in the lumbar and the sacral areas from the lumbar vessels and the sacral arteries, respectively. Now, examiners are just in habit of asking about what is artery of Adam-Cavish, and basically it is nothing. It is usually a large branch, usually from the abdominal aorta or from the intercostal arteries, and it sometimes supplies a significant portion of the spinal cord, and inadvertently any neurosurgeon or a spinal surgeon can just come across this vessel, and in case of non-identification he can damage this vessel. There, as a result of which there can be infarction of the large part of spinal cord, because this vessel sometimes supplies a large area of the spinal cord. And in addition to that, you have to remember that the posterior spinal artery is a very important vessel which supplies the posterior most parts of the spinal cord. And what is the functional significance of the anterior spinal artery and posterior spinal artery is something which we will be coming across, and then we have got the anterior spinal artery syndrome and the posterior spinal artery syndrome. The brief mechanisms I will be discussing just at the end. So you can see that this is the blood supply of the spinal cord. Now, as far as the venous drainage of the spinal cord is concerned, it also follows the spinal arteries, but there are 6 longitudinal columns, 2 anterior lateral, 2 posterior lateral, and 1 anterior and 1 posterior, and they correspond to the distribution of the vessels. In the cervical region, in the thoracic region, and in the lumbar region, these veins drain respectively into the vertebral veins, the intercostal veins, and the lumbar or the sacral veins. They form a crown across the spinal cord longitudinally, and this follows the vascular supply like the arteries. So this is something about the venous drainage of the spinal cord. Now coming about the anterior spinal artery occlusion and the posterior spinal artery occlusion, you will be well aware that the anterior columns and the lateral columns are supplied by the anterior spinal artery. Almost anterior 2/3 of the spinal cord roughly is supplied by the anterior spinal artery, and posterior 1/3 is supplied by the posterior spinal artery. And we have the columns like the dorsal column medial lemniscus pathway, or the fasciculus gracilis and fasciculus cuneatus, which transmit the position and the vibration sense. So occlusion of the posterior spinal artery will be manifest in a patient by loss of position and vibration sense, leaving the pain and temperature sense intact. Now, as far as the anterior spinal artery is concerned, you have the anterior and the lateral spinothalamic tracts, and they can be disturbed in the blockage or infarction of the anterior spinal artery, and there will be loss of pain and temperature sensation as a result of anterior spinal artery blockade. And in addition to that, there can be weakness of the limbs, which is due to damage in the anterior gray columns, and the loss of bowel and bladder habits or control, which may be due to damage to the descending autonomic tracts, which also lie within the anterior columns of the spinal cord. So this is a brief recap about the surgical anatomy of the spinal cord, the blood supply of the spinal cord, and some of the important clinical correlates which are very important from an examination viewpoint. I hope that this class would be beneficial for you, and I would be coming up hopefully with many more classes which will aid you in just correlating neuroanatomy, neurophysiology, neurology, or neurosurgery, and they will be very helpful for you in getting an exact idea about these clinical sciences. Good luck. Have a good day.